yourself be the good models for them. Then facing fears is a very good form of resilience. Face the fears, don't be afraid of it, don't go away from the fears. Then develop active coping skills, whatever is required. Develop these active coping skills. There's a talk there somewhere. Am I audible?
Yes, sir, you are clearly audible.
Thank you, ma'am. Thank you. I'll continue. So, one more thing very important, that is training regularly, physical as well as psychological. Breathing exercises. Then, one such method of this resilience training is to talk in a delayed manner. Practice the talking in a delayed manner, which I am not doing because of the internet issues. I am impressing upon the my talk. I am forcing myself to be more audible so that others will not have the problem. But in resilience, we have to be calm and quiet and composed and talk in a coherent manner. Sometimes this is articulation in a in a manner where you do pauses from one sentence to another, which will also bring resilience and lessen your stress. Recognize and foster signature strengths. That's a very important thing which will give you resilience. That is, what are your strengths? What are your own strengths? That has to be fostered. Strengths, what are your negativities, has to be kept aside, but your strengths have to be focused and given priority so that you may use them in the testing times like today's. Increased mental resilience can be attained by mindfully watch for those thought patterns and counter them with more helpful thoughts. Whatever thought, for example, somebody is having a thought of suicidal ideation, which I'll talk in the future in a couple of minutes. Suicidal ideation is one of the biggest problems. You have heard about the Ria and Sushant case, which is running on the media, but that's not the alone. Farmers, low income groups, the people, a lot of people have committed suicides, and media reports are lesser, but many of them in our part of the world, a lot of even security personnel are committing suicides. Suicide is common in it has increased over the period of this 6 months period of pandemic. So overcoming these thought patterns will help you in overcoming the suicidal ideations also. All or nothing thinking. I mean to say, you have to understand what is all and what is nothing thinking. Means either you are part of something or you are against it, on one end of the continuum, or on the other end of the continuum. You have to make sure that you will be on the other end of the continuum where everything is to be taken in the positive sense, and to see the thoughts in the black and white. What thought is positive, that has to be given prominence, and what is negative, that has to be kept hidden, that has to be suppressed, and has to be countered by your own selves. That is how increased mental resilience works. Then think the opposite thought and find the middle ground, developing flexible thinking. If you are not able to find the most extreme part, that no, I will not do it, I will not commit some rubbish activity like suicide, or I will not give up, you can find the middle ground. You can find something which will suffice your intense craving for something providing harm to yourself or proving harmful to your own self. Then personalizing blame, not to blaming others for your faults. It's all my fault if at all I am doing something. Personalizing your blame will resort to two things. One is called guilt, and another is overcoming the personalized blame. Guilt has to be overcome by increased mental resilience so that you may confront the situation. Yes, it is me who has, like, for example, some people may tell you that, were you mad to take the bank loan? Now what to do? You will say, it's my problem. I will handle it. I have got the potential to handle it because at that time I didn't knew that I may face this problem of COVID-19 and my loan will be problematic for me. No, it's not me to be blamed, but it's the situation which is to blame. But I'll take the responsibility. I will overcome it. That is the thought pattern which we have to substitute from the negative ones. Then selective perception, watching for the negative, seek out the positive in yourself and others. Watching for the negative and seeking the positive in yourself and others. One very significant thing which helps in this kind of a discussion on social support and resilience is making group discussion in the families and whatever people you have around. Give each person a minute or two to share, discuss one or one of the more of the following things. Like, what are the following things? Someone who you admire is to be discussed so that you will gain the resilience. Second thing is, in your own life, describe a situation in whatever your own life has been faced with, and try to see the possible problem focused coping strategies. What is problem focused coping strategies? Means that you have to brainstorm many possible solutions to the problem, which will render you finally to a best suitable solution to the problem. It will come in the group discussions. So do the group discussion in the families quite often, because most of the family members don't talk to each other. That's the biggest problem nowadays. Cultivating resilience in your own life will also be helped through uh, a patient or a colleague who will demonstrate to you, who has already been the victim of COVID, will come to you and will tell you that what works in kind of these problems where you have a lot of people. I have witnessed a thing that whenever I talk to the people who are COVID positive, I do talk to them because they need social support. I tell them that this will be over. I do not blame them that this is nothing. This is a problem. This should be understood. But at the same time, you have to understand that you have to tell them that I am with you. You are not alone. So don't stop talking to me. Talk to me whenever you feel. I'll be available. So this will help in friends, families, and even those people who are not in psychology professionals. They do not know the client, but they have to be very positive in their attitude and in their interaction. Then share an example. Sharing the example will help also in reducing the stigma also of this COVID pandemic. Then enhancing your resilience at the workplace, like you are doing all the work from home, being very accommodative. For example, there might be technical issues because we are new to technology. Most of the people are new to technology. And one very great myth is that women are less equipped with the technical expertise. But that's not the case, because I have been to many webinars in this period of 6 months. I have seen women are well managing the webinars, and even countries also. So this is a very significant kind of an observation which I have taken from these webinars. Attaining psychological well-being will be done by general things which mental health professionals talk to us, like exercise, deep breathing, meditation, and yoga. As I talked, maintaining a biological clock is very important. Activity scheduling is important. At what time, what type of activity is suitable and I should do. Don't take your classes or don't interact with a work group beyond day, daylight or in the evening. That will create a problem. It will hamper your sleep also. This is an example. Similarly, we have adequate sleep is very important. Acceptance of the problem, that is accepting the problem, that problem is there, economic loss is there, job loss is there, and trying to figure out what can be done to overcome it. Not to divert the issue the way our most of us are doing in present times, by ignoring it. Ignoring is not the solution. Confronting is solution. Being in the present means being to live in the present, not to fantasize about what was good in the past. I used to be in the greater places in UK, Canada, or somewhere, and now I'm hanging up in the home. No, that will not help. Being in the present means the present situation is to be dealt. That is a very good psychological characteristic in people to overcome mental health issues. Supportive home environment is to be created at any cost, and show the ways rather than say how the resilience works, or showing the way at the home will help you. Socio religious activities I talked about is, what is the socio religious activities is that if at all your temples, mosques, churches, everything is closed, now being opened gradually, but you can have a connect with the God at home, in the isolated places, at around wherever you feel comfortable. Then community services are to be undertaken by the people so that they can overcome these problems. Then faith and religious affiliations will always work. Now management has talked, I will not repeat it, that Dr. Archana has already talked about it, that how to manage this pandemic by resorting to whatever the best way you can visit to clinics or reduce the clinic these opportunity appointments with the doctors. So, but sometimes you need the appointments also for some issues which are there, and there you have to manage very well. You have to go and you have to take precautions. Medicine is one of the sources, but reduce the tele form of medicine, not to take more time in online consultations. That will uh, create a problem. Similarly, utilizing community health workers or trained social workers for screening of older people, and this is all social and
बस कुछ नहीं,
psychosocial,
थैंक्स करके हट जाओ.
management.
हाँ
Uh,
हाँ.
Dr. Juhi, if I'm correct, will talk
सबका
about
कल
it because
देखा
she has
जाए.
been a
हाँ.
frontline worker in these kinds
और
of
ये सुनो ना,
managements.
ये बच्चे गलती से लेफ्ट हो गए ना, उनको फिर से हम ज्वाइन करना
Sorry.
चाहेंगे तो
Uh, I'm not able to understand because there is a lot of background noise there. Am I audible to the audience, please? Participants?
yes sir, you are quite audible. Yeah.
Yes, sir.
अपना अपना मोबाइल
Okay.
में ऑडियो वीडियो दोनों ऑफ कर लें, साउंड बहुत गूंज रहा है. लक्ष्मी जी, आप लक्ष्मी शर्मा, मिस्टर लक्ष्मी शर्मा,
Thank you.
mute yourself sir
Thank you.
kindly.
I'll continue. Okay.
मेरा ऑफ है.
हाँ.
Okay, ma'am. Okay, ma'am. Now it is okay. Then utilizing community trained workers and others, get them out of their homes because most of them are hidden at their homes. Now nobody is hidden. Some people have come out. The stigma is less, and the over magnification of the pandemic has lessened to a greater extent. And now people are coming out of their dens and they are joining the healthcare workers in the field. So creating an environment of exposure, uh, creating an environment of reducing the exposure to an infection by resorting to SOPs, not to close the windows and doors, but to be available with all possible preventive measures. These are the management related issues, psychiatric emergencies like suicidal risk, severe agitation, catatonia, refusal of food or delirium, dementia patients, old age disorders. They will have problems. So their visit to the doctor is inevitable. That has to be done and has to be done on priority. That has not to be, ignored, because ignoring that will create the problem. People will die out of some other condition while securing themselves from COVID. So psychological interventions, I'll talk about more some a little amount of more psychological interventions in a detailed manner. That is, all vulnerable people are likely to have sub syndromal mental health issues like anxiety, depressive symptoms related to COVID-19. This will require brief psychological and psychosocial intervention. It can be delivered through any healthcare personnel, volunteers, or mental health professionals. For severe forms of mental health problems, you need to visit the professionals and visit the clinics. And then you have older adults need a reassurance that most of the mental health issues experienced in these situations are normal. I'll talk about the new normal. What is normal? In a couple of minutes now. Normal reactions, these are older adults are, taken care of, and they are reassured that this is a normal reaction to abnormal stress. It is abnormal stress, of course, and it is a normal reaction. Whatever you are reacting to is a normal reaction. It is appropriate to seek information and clarification. It's not any stigmatic thing to be hidden at home. So encourage the older population and take good care of their health and other parameters, food, nutrition, and other things. Even if you require to do it at community level, it will improve your mental health for sure. Guidance about maintaining a routine, physical exercise, yoga, meditation, all these things will have to be done on religious grounds. Religiously, I should say, means with strict things in a couple of days, in 3 days' time, in a week's time, once, twice, thrice, you have to do it so that you will be stable in your thought patterns, in your physical fatigue, in your psychological functioning. All these things are very important. So then after, you have to take a special care of one more thing I'll add to it, that is a collaborative care model of coping. That is the model of therapy in which health professionals from two or more disciplines cooperate in the diagnosis, treatment, and disposition of an individual patient. Why do I have included this collaborative care model in coping? Because so far we witnessed that all the problem is faced by mm, physical health or general health professionals in the hospitals, at clinics, and at the different locations. But mental health people are separately functioning. In fact, a group of people should be there, and mental health professionals should be there along with them, so that a problem can be managed on general health level and mental health level. Then co-location, the collaborative model in which a behavioral health practitioner is actually located and functions within the primary care setting. So this is a primary care setting where healthcare professional can co-location will help in this collaborative care model of coping. Then, as pregnant women, has certain recommendations are there. I think that has been touched by Professor Archana already, but a few of the things I'll add to it. That is, taking care of your physical activity is not only important. Taking care of your mental health is also important, because a lot of people, if might not be having this they will not prioritize their mental health while having physical health related issues. So giving prominence to your health will help in the development of the fetus or the baby in a very healthy manner. Minimize watching, reading, or listening to news amidst news of COVID-19 and other things, because it may cause you anxious or depressed. And similarly, some other things are there, like growth and development of the baby. It is important that you have to take adequate amount of nutrition and mental health related, as I said, yoga, meditation, and other things which work in securing mental health. This is a very important thing in case of pregnant women. Similarly, protecting from yourself and your baby and your to take an extra care is what is recommended for these ladies who are conceiving, because not only to protect themselves, you have an additional moral responsibility of to protect these newborn which are growing in the womb of the mother. So these are important things which we should share with our people who are expecting, because we have to take care of this also. One of the very significant things is, which I will add over here, is the this interventions for suicide prevention. So certain things are to be taken care of while we devise a strategy for suicide prevention, because September is the month of suicide prevention. Always globally, we have been celebrating Suicide Prevention Day on 10th of September and Mental Health Day on 10th of October. So these 2 months are coming, two dates are approaching. We must all have this commitment to find it convenient. How can we help in this case, so that uh, we may be able to secure some of the lives which are in our hand. So genuinely feel that whenever you find these kinds of people around who have these negative thought patterns or suicidal ideations, they may be helped with the positive assertions by saying that I am here to help you. Similarly, be a good listener. Listen to them whatever at any cost, because listening to them will help them to bring out their inward stresses and the problems which they are facing. Similarly, you have to avoid certain things, like avoid making dismissive comments that this is nothing, you have nothing to worry, this is nothing, no problem is there. But this is a dismissive comment which should be avoided. Problem is there, so accept it and be honest with your friends and family members and the people around who are having these kinds of intentions or ideations. Be non-judgmental, don't judge people. It is very recommended always. Building a contract by signing a contract with the friends, family members, and people, making them take oath that I will review my decision once. If I'll think about the suicide, I'll review my decision once, and I'll think of the decision that it's not unbearable, it's not unimaginable, it's not uncurable. I can have a have a strategy for my problem. So why to waste my life? So this is signing a contract, making promises with the people that don't ever try to do this thing. Instead, talk to me. Be counselors to the people who are having these kinds of problems. You will overcome a lot of problems to the lot of people. Distraction from the suicidal thoughts may help them, may help people who may have these kinds of thoughts, like reading books, keeping in touch with family. Mobile phones and all should be avoided to the greater extent. But if you are watching a movie, watch for some time. This will help you in distraction of suicidal thoughts. And collaborative kind of strategies, like making a group of people chatting on for a limited amount of time, of course, but making a group of people will help you share ideas that will help you reduce the amount of suicidal ideations. Talking to friends and family, as I said earlier, social support is what constitutes the heart of our overcoming this pandemic. Resilience and social support are the two prime things which we have to take care of. Then psychotherapeutic consultation, wherever required, should be taken at that very particular moment. Constant vigilant, this observation is what is very important for all kinds of these people who are having suicidal ideations. This is important because constant vigilant, this observation is very important to our children also at homes, because most of us are parents and we all know that we have to what they as thought patterns and other things. So this is something, and there's on the screen you can see uh, there are some contact numbers available, and these are helpline numbers. One is of NIMHANS, National Institute of Mental Health and Neurosciences, Bangalore, and another is of Manodarpan. So if some people still require after after joining the webinar, which has been this organized by Professor Abha, she has done a great job, and the entire department is commendable for this, because in this period of times, in this threatening times, not only your university or your college, Vaishali Mahila College, Hajipur, but entire student population is in distress, in a lot of psychological problems, and having these kinds of webinars may, if organized properly, may reduce the amount of threatening these consequences for us. So this is these contact numbers or the helpline numbers are there. If somebody still feels after uh, watching this webinar, uh, these are the alternate ways of contacting the people, professionals, online, so that you can overcome your problems and stresses. Furthermore, because Dr. Abha, Professor Abha told in the beginning that at the very onset that I'll talk about a little about the anger and other things in the general population of Kashmir. Like other parts of the country, Kashmir is not different, but the amount of distress we are facing because of the ongoing conflict, and that has added to the problems which we are facing today, because that we were in the lockdown, not from March 24, but we are in the lockdown from last 5th of August, when that special status was abrogated or amended, I should say. Since then we are in the lockdown, and a lot of stress is there, suicide rates has increased, and we are facing a lot of challenges as mental health professionals. And you being connected to one of the premier colleges of the Kashmir, because you have been coming and receiving their participation in these women studies centers and circles, you are aware of the general population here, who are not very much hostile as has been projected, but very much cooperative, very hospitable, and very much loving people. So that helps the people
presentation.
to overcome this stress, to overcome these problems. So this is the general introduction which we are facing over here. We are not different from other parts of the country nowadays, except in a few these things where we are suffering a little more than others, but suffering is there to the entire world. Let us hope this pandemic goes very quickly and we will come back to normal, because Now the normal has changed, and a very discussion and discourse is on the new normal, that is this pandemic normal, and we have to overcome and adjust to it. That is what is a psychological strength of adjustment. So thank you all for having a patient hearing for the entire this 1 hour duration or 45 minutes duration, whatever time I have taken. I'll be happy if somebody wants a further clarification on this presentation. Thank you.
Hello, sir.
Yes, ma'am, please.
Assalamu alaikum.
Islam?
Sir, I'm also from Kashmir.
Yes.
I really liked your speech and your presentation, but the presentation was totally not visible, and I was also hearing what you were delivering, but I got no presentation. I request you to share your presentation with us.
And being in the part of this part of the world, you know why this presentation was not shared. It
Yes,
might
yes,
have
yes,
been blurred.
because,
So not an
yeah.
issue. You can contact on my email ID, which is on the last slide of the presentation. I can send you the presentation to your email.
Sir,
Not a big.
we don't see anything. We don't see the numbers you discussed about helpline numbers. I don't see that. I don't see your email ID. How can I contact you?
My email ID is waninavshad@gmail.com. So you can contact me on any time. All other participants from different parts of the country do. Uh, are you having my email ID there? If anyone wants to further, get the presentation, I can mail you there, or this is there in with Dr. Prabha, the smart anchor of the program, who has done this magnificently. She can provide you. You can contact her also, or head of the department, Professor Dr. Abha. Abha Rani Sinha, the very active person in the field of psychology. So you can contact them. Anyone else, please, if anything further you need clarification.
Thank you, sir.
Thank you all. Thank you, everyone. Back to you, Dr. Prabha.
थैंक यू सर, आपने हमसे इमरजेंसी कॉन्टैक्ट्स को भी शेयर किया और जो हमारे स्टूडेंट्स हैं, व्यूअर्स हैं, उन्हें इसका बहुत लाभ होगा। और आपने जिस पॉजिटिविटी एवं सोशल सपोर्ट को विस्तार से समझाया, इस पेंडेमिक में कोप करने के लिए बहुत ही आवश्यक है। और आपने तो मेंटल हेल्थ इश्यूज को हर एस्पेक्ट से बहुत ही डीपली समझाया। थैंक यू सर।
थैंक यू, माय प्लेजर मैम, माय प्लेजर।
और समय हो चुका है और इसलिए मैं आप सबों का धन्यवाद करती हूँ और आज का सेशन यही समाप्त होता है। कल हम सभी इसी समय पर ठीक 12 बजे हमारे इनवाइटेड एमिनेंट स्पीकर्स डॉक्टर रजनीश रत्न सर जो भूटान से हैं तथा डॉक्टर जूही सिन्हा मैडम जो बिहार से हैं, उनके विचारों से लाभान्वित होंगे। और आप सभी पार्टिसिपेंट्स हमारे वेबिनार की शोभा हैं। तो इसी अपेक्षा के साथ मैं प्रिंसिपल मैम को थैंक यू करते हुए और आपसे सहमति लेते हुए अब इस सेशन की समाप्ति करना चाहूंगी। प्रिंसिपल मैम।
Yes, great.
ओके मैम।
Very well organized, very informative. Thank you.
Thank you, ma'am. Thank you so much.
Thanks.
Means a lot, ma'am.
थैंक यू सर। और आज का सेशन यही समाप्त होता है, तो मिलते हैं कल। बहुत बहुत आभार, बहुत बहुत धन्यवाद।
Thank you.